Can blood flow restriction training, basically working out with a tourniquet, actually help you recover faster from injuries and surgeries? I'm Dr. David, orthopedic surgeon and sports medicine specialist, and I want to help you feel and perform your best regardless of age or injuries. Now, in a couple prior videos, I've talked about blood flow restriction training, basically working out, lifting weights with a tourniquet to get stronger, build muscle size and strength. But I also mentioned it can help you recover from injuries. And there's a couple ways that this is being used. It's really popular right now in the physical therapy clinics. So after ACL surgeries or after total knee replacement surgeries, physical therapists are starting to have their patients wear these tourniquets and then do exercises in rehab. And it really helps to get quad strength to come back and really strengthen the whole lower extremity. Now, if you're either suffering an ACL injury or serious knee injury, or you have and you're now trying to recover from it, this may be something you think about. And I want to show you some exercises you might think about doing. But it's also been shown to be really good for people with early arthritis, like knee arthritis. Basically by wearing a tourniquet and doing very low weight exercises, for 5 to 8 minutes, it's thought to be very good without the struggles of trying to do high weight exercises. Because with pain with arthritis, you're probably not going to be doing heavy sets of squats or leg presses. But even low weights can still build that same muscle strength without the associated discomfort from it, the aggravation of the joint. And we think, that there have been studies that show it actually does help with the pain of arthritis. So, if you're recovering from a knee injury or if it's just chronic aches and pains of your knee, and it doesn't just have to be your knee, with this blood flow restriction training, even though the tourniquet is on your thigh, it can give benefits to the muscles below the tourniquet and the muscles above it, which can be really helpful, say for hip arthritis and strengthening the gluteal muscles and the hip rotators and abductors, even though again they're above the tourniquet where the blood flow is being constricted. Same thing kind of works for your shoulder and your chest muscles. You can't put a tourniquet that's going to stop blood flow to that area, but you can put it on your arm and do exercises, say for your biceps and triceps, that yes, will help get your forearm stronger, help get your biceps and triceps stronger, but can also help get your shoulder and chest muscles stronger. So let's say, for instance, that you have pain from a shoulder injury, maybe a rotator cuff tear, it's just this nagging shoulder pain. You could put the tourniquet up basically on your upper arm and then do sets of bicep curls and tricep extensions. And it can be, light dumbbells, 5-10 pounds. Again, look for that 20 to 40% of your 1 rep max, but just low weight bicep curls and then low weight tricep extensions, and that can be very effective. And we've talked about in prior videos some of the protocols, sets of 30-second rest, sets of 15, 30-second rest, set of 15, 30-second rest, set of 8, and then you drop the tourniquet. But there's all different ways to do it. Alternate one exercise for 30 seconds, other exercise for 30 seconds, and you go back and forth like that until you hit 5 minutes, something like that. So that might be good for the shoulder. Bicep and tricep work for 5 to maybe 8 minutes. Now if it's your leg, big knee injury or arthritis, again, the leg press and squats may be difficult. So you could say put this on your upper leg. See if I can do this quickly, where you get it tight, but it's not brutally tight. Like I've told you in prior videos, maybe a 7 out of 10 in terms of discomfort, so that it's uncomfortable, but it's not awful. It's basically keeping the venous blood flow from getting back up your leg, but it's not preventing arterial blood flow. And you could do basically very straightforward, say straight leg raises. I'm not really stretched out so I can stay in the shot, but basically with the tourniquet up, maybe you do this for 40 seconds and then maybe you hold for 20 seconds. And then as soon as the 20 seconds are up, do it again, another 40 reps. Or that may be even too much after your injury. Maybe you just do set of 30 and then you rest for 30 seconds, leaving the tourniquet up. Another 30, rest for 30 seconds, and you do that till you get to 5 minutes, something like that. You can even just put this on, get it elevated, and again, you would do both sides in this case, and just walk and you do that for 5 to 8 minutes with the tourniquet inflated, and that can help build that muscle strength. And if you build the quad strength and the hamstring strength and the hip abductors and external rotators and the gluteal muscles and your calf muscles, that's going to do wonders for strengthening the muscle, taking pressure off the bone and cartilage, say for arthritis, building that strength to take pressure off the joint, say in a knee injury like an ACL, but also help you get more active and more functional after that injury or with that pain. If this was helpful, check out my other videos on blood flow restriction training. Leave some comments below if you have other things you want to hear about as far as exercises to do for joint injuries. I look forward to seeing you in all of these videos very, very soon.